Hi everyone, my name is Saanika Jain. Today, I'm going to present my work on a rare genetic disorder called congenital insensitivity to pain and its relevance in the global health field. Before I begin, I'd like to introduce myself. I'm a 12th grader from Bangalore, India. I'm very interested in biological sciences and global health. I'm also the school prefect and I've acted in professional theatre performances. Now, let me ask you a question. What if you could never feel pain? It sounds like a gift, doesn't it? But for individuals with congenital insensitivity to pain, or CIP, this is a dangerous and life-threatening reality. I first came across CIP when I was in fifth grade. Like most people, I thought it sounded like a superpower. But as I learned more, I realized that the inability to feel pain means that people don't recognize injuries, burns, or infections, often until it's too late. And all of this happens because our body's natural alarm system, or pain, is completely offline. Most global research into pain focuses on chronic pain disorders. They're common, better understood, and heavily funded. But pain insensitivity disorders, like CIP, which affect roughly 1 in 125 million people, are dramatically under researched, especially in low and middle income countries. That's when I decided that this disease deserved to be understood better. My research, a literature based review, explored how mutations in the SCN9A gene cause CIP and how diagnostics and gene therapies could transform outcomes for affected individuals. So, pain sensing relies on specialized nerve receptors that we call nociceptors. In CIP, these nociceptors become non functional, which means that they are unable to respond to pain signaling molecules despite being in their correct anatomical position. This malfunction often happens because of mutations. The SCN9A gene encodes for a sodium voltage gated channel called NaV1.7. NaV1.7 plays a crucial role in transmitting pain signals by regulating sodium ion flow in neurons. When this channel is open, it allows sodium ions to cross and generates a pain signal. However, when this gene mutates in a loss of function way, like in CIP, this channel becomes shortened and it shuts down pain signaling completely. Basically, what happens is that the mutation closes the NaV1.7 channel. As you can see in the figure, this does not allow sodium ions to cross, and thereby it doesn't let a pain signal generate. But the real challenge of CI lies in ensuring diagnosis and making sure that treatments are accessible to patients everywhere. Diagnosis is three-layered. It starts with assessing physical symptoms like sensory and motor function, followed by pain sensation tests. After this, genetic testing is done only in some cases. But in a global health context, expanding access to genetic diagnostics is essential, not only for early detection and timely intervention, but also for prenatal risk assessment, particularly in regions with limited awareness or infrastructure for rare genetic disorders. When we think about therapeutic approaches, current treatments are mostly focused only on symptom management. This includes preventing injuries, regulating body temperature, and ensuring close supervision in children. But when we consider low resource settings, even these basic measures become hard to implement, highlighting health inequities faced by rare disease patients. And that's why genetic therapies offer so much promise. They target the root cause, the faulty gene, rather than just managing symptoms. Some of the most promising approaches include CRISPR-Cas9, which edits out the harmful mutations directly from the DNA, RNA interference, or RNAi, and antisense oligonucleotides, which silence the mutated gene's harmful effects, and stem cell therapy. Stem cell therapy corrects the mutation in patient-derived cells outside the host's body, and then they're reintroduced back into the body to restore normal function. What's exciting is that this research doesn't just benefit those with CIP. These therapies are forming a blueprint for treating a wide range of genetic disorders. Rare diseases such as PIP may seem distant, but they highlight critical gaps in global health infrastructure, especially around genetic testing, early diagnosis, and equitable access to emerging therapies. By studying CIP, we're not only paving the way for advanced treatments, but we're also working towards a more inclusive and innovation driven global health future. These are the resources I have used for my research. Remember, with genetic therapeutics and structural biology, the future of pain research is no longer a question of possibility, but a question of time. Thank you for your time today and for listening on this topic.